In this talk, I would like to ensure all the medical doctors, but also all the parents, that vaccination is extremely safe and that all the vaccines are not associated with any risk of autism. Unfortunately, in the 70s, medical doctors from UK has published a report on the association between measles, mumps, rubella vaccine and autism. And it was supposed that the measles vaccine was able to increase the risk of autism. Then after a few years, the medical doctors say that these data were totally untrue, and it was discovered that for conflict of interest, at the end, he has totally put data that were not true. So all the studies that have been done have seen that there is no risk at all of measles vaccine, but also of measles, mumps, rubella vaccine and all the other vaccine with autism. So I think that is very important because we should start from what the scientific studies have documented. And the scientific studies have documented that vaccines are not associated with any risk of autism and neurological delay. So I think that this is very important because in this time in which we have anti-vaccination movements that highlight something that is not true, so this risk that is not true, we should say what the evidence-based medicine has demonstrated. It is clear that in the first months of life you can have a risk of developing neurological symptoms, but these risks are in several cases due to a sort of genetic background of the single person. So this means that when you receive vaccines as well as antibiotics, if there is no there is a causal relation and not a causal relation, at the end there is no association between the vaccine itself and then this risk. I think that is very important that all the medical doctors and all the parents understand this point, because we have really to increase for measles the vaccination coverage in order to reach the WHO goal of elimination of measles and rubella worldwide.